I think we have a misconception about rural medicine. When I came out, I thought I'd be reading a book by the fireplace most nights and just kind of taking it easy with my family. It's busy, so on the same token, we work hard and we play hard, and we enjoy playing in our local environment and enjoying the surroundings.
Doctors have a lot in common. They're explorers.
Heart failure.
And detectives. They like a challenge. And have a deep respect for all creation. They enjoy the company of other people and the human experience.
I love these hugs.
Yes. Does that hurt at all? No. What sort of a strong medial lift to try?
They witness miracles and sometimes perform them. They are doctors and they love their work.
It's okay, it's okay. I'm sorry, I'm sorry.
Come on, everybody, let's go!
Meet Dr. Michael Kolber.
Sure, yeah, I'm cool with that, yeah.
Here's Mike with some of his patients. They think he's pretty special. Have you ever wondered what a doctor does? Let's find out.
It's part of the challenges of rural medicine is you taking care of your friends. And, you know, hopefully most times it goes well, and sometimes it doesn't go as well. I had to tell my other best friend that his son's got leukemia, and that was about 3 months ago. And hats off to them. They said, you know, Mike, I didn't want to hear it from anybody else. You know, so I mean, it's difficult to do, but when you hear that, you say, you know what, it's meaningful, and they're pretty strong people, and but appreciative people also. Yeah, so I'm late. In the backyard. I'm retiring tomorrow. No, it's we in Peace River have a vision for the future, and we are trying to build the go-to rural medical community in Canada. We're going to do rounds every morning. We round in the hospital of our inpatients. Hey, Len. Hi. Those are people that are sick enough to be in the hospital. You okay? Does the oxygen help?
Oh, yes.
Morning, Tom. It takes us about an hour to do our rounds. Then we check up on our lab work. Morning, Rick. Make sure everything else is okay, make sure emergency department's okay.
2 girls hit a moose and another snowmobile accident.
Well, off to the office.
Have a good day.
I will, for sure.
Okay.
Well, it was very good. Thanks for asking. Yeah. Hi, Marla. How's it going? Yes, please. That'd be great. Thanks, Katie. Hey, Brenda. Hi, Glenn. This is Metro. Metro's a long-standing patient of ours, and Metro has ankylosing spondylitis. So we use them for the medical students to try and guess what Metro has, and every time they guess right Metro, we give them a quarter, hey? Yep.
No, you never paid me yet.
Never paid you? No, paid the med students if they get it right.
Good.
So what has the doctor done for you?
Made my blood pressure go up.
Yeah, exactly. Myself, I see between about 30, 35, sometimes more if they got to be squeezed in, but after 35, it's a pretty busy day. I thought I was going to be a whale doctor. And I really digged whales and knew a lot about them. And then when I got older, I said, you know what? I think there's lots of whale doctors out there. I think maybe I'll be a people doctor. So, yeah, just kind of hit me in more in university. And it kind of changed and picked medicine as a career. I didn't know if I was cut out to be a doctor. I think I kind of looked neat. I thought, geez, who knows? Why not? My mom always said you can do anything you put your mind to. So put my mind to it and got in and enjoyed it. Okay, I'll get some presents. The good thing about family medicine is we really never know what we're going to get when we walk through the door. So it can be anything from a wart to depression to abdominal pain to heart attacks, and so we'll see what the day brings, and should be a really good day. So, how's it going? Good. Good. We may have 30, 40, 50, 60 encounters a day, but you always have to be, for that individual, it's their one encounter. So always trying to bring your top game to when you see the people. 110 on 7. Perfect. Was it coughing to the point of vomiting, or would he vomit outside of the cough?
Yeah, when he coughs, he...
Cough. And puke? Okay. Is he pulling at his ears?
He was eating yesterday.
We listen. And I think if you listen long enough, they're gonna tell us what's wrong, and if we even listen better, they'll tell us what to do. And I think our best asset and our best skill, and sometimes we forget about it, is just being a listener. And sometimes we have to come up with something, but really, if you listen to the patient, they'll tell you what, A, what's wrong, and B, how to fix it. Good boy. Hey, hi Dylan. How you doing? Long time no see. Hi, Al.
How you doing?
Good, how's it going?
Good.
Okay, how old's your mom?
71.
71. And when was she diagnosed? In this last year?
A year ago, yeah, about a year.
Family histories are obviously really important in medicine. We go looking for and preventing diseases that are transmitted genetically. So this is a really important part of our job. Okay. Anybody else in the family? Brothers, sisters, anything like that?
My sister right now is not in very good shape. She was diagnosed close to the same time my mom. She's got cancer in her bone marrow.
When you hit 40, you and me will have a date, and we'll do a telescope. Okay. Thanks.
See you later.
Yeah.
Take
See you
care.
guys.
Come on, Dylan.
Bye, Dylan. Okay. Hey guys, where are you going? You guys
go to the candy machine.
Sure. Go to the candy machine first.
Okay.
That's cool. I'll come say hi. So this little child was actually at the ski hill yesterday at the party and injured their leg. You got to know the parts. I mean, if you don't know the anatomy or how the physiology and stuff works, obviously we'd struggle a bit. An undisplaced fracture here in the tibia. But it's obviously more than just mechanics and body parts. It's the person and the whole concept.
Actually, wasn't that?
Oh, it's the other leg. No, I'm just kidding. Just kidding. God gave. And I think that's where I personally really enjoy family medicine, is the relationships and you know the past and you know their family and their extended family.
A what?
Bologna.
Bologna.
Yeah, I don't think we'll go sky high.
Bologna.
Bologna cast. We can have. Do you want a bologna cast? And a pneumonia is not a pneumonia is not a pneumonia. It's this person maybe having pneumonia, but the mom had lung cancer, so she's very worried that she's got lung cancer, what have you. So it's more than just the body parts for sure.
Okay.
You okay, Josh? As far as medicine goes, we do what we were trained to do. We do everything from deliver babies to deal with palliative care, heart attacks, broken bones, you name it. So it's the skill set that we were trained to use, that we use day in and day out. And I was the first guy in Canada to actually do the training, a formal training in GI medicine as a family physician. And part of it, I had to have a return for service agreement for an underserviced area. My Kolber emergency home visit, Geraldine Swanston, end-stage palliative MS, February 27, 2006. House calls. I think one house call is worth about 10 visits in the office because you actually see how they live, how they cope, and very enlightening. Try and do it about once a month, sometimes more often if there's a palliative. We currently have a palliative patient on that lower West Peace side.
Because you'll see she seems to be not in pain.
Yes,
but
just breathing heavier.
Yeah.
Is she responsive, opening her eyes? Although it's difficult to break the news saying we have a condition that's non-curable, I think we caveat that with, you know, we'll make the remaining days that you have as peaceful and as dignified as possible. I think that's really powerful, and that's an aspect of medicine I really actually enjoy almost the most, because we can do a really good job at the end of life care. As you see, we think quick, we work quick, and afterwards we ponder. Glad you're feeling better, Gary. Yeah, we're gonna give you a little blood thinner in the belly. Okay. We all see the same cases. I mean, we see heart failure, we see palliative care, we see babies. We're not sharing offices with all these specialists where the expectation is if I do have heart failure, maybe I need to see the cardiologist, or if I have a child problem, then I need to see the pediatrician. So I think due to the geographic distance, we're able to take those cases a bit further. You're stuck with me. How's that? Yeah. Okay, I'll take care of you tomorrow morning. Okay, we'll get things organized. I'll keep checking on you, okay? So how did she hurt you on the right side?
Well, she picked me up and threw me against the wall and on the manure.
Sometimes it's a little trickier, and sometimes you're like a detective or a mechanic, and you start off with it's almost like a funnel. You start off with a multitude of complaints or concerns. Yeah, so all the x-rays are on computer, which is really fantastic for no films. We were the first... I think one of the first places in Canada to actually have a filmless radiography department, so it's really excellent. You can see how this heart border looks reasonably well okay, and this one's kind of obliterated. You don't see it as well, and it looks like heart failure. Tell me about the chest pain that you had last week.
The chest pain, it started about 2 o'clock in the morning. And
you kind of funnel them down and weed them down as to what's really important, what's maybe not so important, maybe a red herring, and coming up with hopefully a provisional diagnosis, and a diagnosis makes sense, and then some treatment and trying from there.
No.
So you had no pain, and then the pain came back after you were hit by the...
That's right.
But you have 2 different pains.
I've got 2 different pains.
Yeah, I mean, these farmers are tough. He might have cracked a rib. These guys, as you know, he had chest pain for a whole night, never comes in. So he may have something. You wonder if he's have a little bit of a fever. If something else going on, because it doesn't all quite fit. So it's like a detective. This is a bit of the other one's fairly straightforward. It's the guy's got heart disease. He's got chest pain. He's got recurrent heart disease. This one, it can be a multitude of other things. So we'll try and chisel that one out. So fair.
That's fair, Doc.
Okay.
Thanks, Doc.
My pleasure. Okay, we'll see you in a few minutes. So this is a lady that was assaulted. I think really in medicine we make suggestions that people may take or not take, and I think if we start imposing either our values or beliefs and telling them you are going to do this or you do this, I think we're losing some of that patient-physician relationship.
My boyfriend beat me up.
Oh boy, when did that happen?
Saturday morning. I don't know if it was Saturday about 5 in the morning.
No sexual assault or anything, it was just physical assault. Did you knock out? Like, did you pass out, or? Okay.
Pretty sure you did.
Okay. So how does it make you feel?
I'm pretty hurt, I guess.
Yeah. Where are you living?
I live in Saddleback.
Okay. Is that your regular house?
Yeah.
So you're not going back to Saddleback right now?
He's in jail.
Oh, he's in jail. Good, good. And you got the kids?
Yeah.
Okay.
I remember everything, and then I don't know.
I'm really proud of you for pressing charges, right? You don't deserve this. Yeah, you know that, right? Okay. I think some of the most important skills are being a person, people person, being able to communicate effectively. Medicine's hard work. It really is hard work. So just always being up for your game, being the best you can be. Again, communicating, hardworking, and. I mean, everybody's got the brains, I think, to do it. They just got to set their mind to it. we get satisfactions from just a thank you card. Geez, I get pickles and jam and bread from the little ababas that you help out, and they're really appreciative. The other satisfaction is just seeing programs start, the GI program start, just growing as a medical community and helping out the people that need to be helped.